Unfortunately, many healthcare professionals out there are still advising their patients to just rest after concussion. Oftentimes, I'll have patients that have been to the emergency department and they've been told by the doctor in Emerge that, yep, you got a concussion, take 2 weeks off of everything. Telling them to sit in a dark room, don't do anything, don't go to work, don't go on your phone, don't do anything, don't even think for the next 2 weeks. And what we're starting to realize is that this is actually detrimental to patient recovery. Beyond a 2 to 3 day period, rest actually makes you worse. And I think that's something that a lot of concussion patients haven't yet realized, is that rest is probably the thing that's making you worse. Even though you feel better at the time when you're not doing anything, over time you're just getting more deconditioned and you're actually making yourself worse. Listen to this. A randomized control study by Thomas et al. In 2015 found that having a mandatory 5 days of rest was worse than if you were put in the group that only was given 2 days of rest and then kind of pushed back into activity. So 2 days of rest better than 5 days of rest. Similarly, another author by the name of Moore in 2015 found that patients who listened to the advice given by their doctor to rest actually ended up with worse outcomes than those patients that decided not to listen to their doctor's advice to rest. Those that just kind of went back into their activities ended up recovering sooner than those who did not. Now, I'm not talking about going back and playing dangerous sports, okay? We have a concussion that needs to be recovered, so there's a difference there. We're talking about going and doing cognitive activity, going and doing light physical stuff that doesn't involve the risk for contact. All of this stuff has been shown now to improve recovery. Just this year, a study published by Noah Silverberg found that advice to rest for more than 2 days after concussion was associated with a delayed return to productivity. Listen to this quote. This study supports growing evidence that prolonged rest after mild traumatic brain injury is generally unhelpful. International Consensus Statement on Concussion in Sport. Here's another quote. So this is kind of the guiding document for how you treat sports-related concussions around the world. And here was a point they were making about cognitive activity and physical activity. Quote, there is currently insufficient evidence that prescribing complete rest achieves these objectives. After a brief period of rest during the acute phase of 24 to 48 hours after injury, patients can be encouraged to become gradually and progressively more active while staying below their cognitive and physical symptom exacerbation thresholds. Basically, the rule of thumb now with concussion is you can do anything that does not provoke your symptoms to a significant degree. What do I mean by significant degree? What is a significant degree? There's two basic rules that I go by depending on the nature of the patient. The first rule I go by is the rule of 5 out of 10. If you're doing an activity and that starts to increase your symptoms, if your symptoms hit a 5 out of 10 in terms of severity and how bad they are, okay, take a break, right? Go relax, go rest for a short period of time, then come back to your activity once your symptoms have subsided, right? You're not waiting for like a little kind of, tingle, or you feel a little bit off so you stop all activity. No. If you're starting to feel dizzy, wait till your dizziness gets to a 5 out of 10, then take a break. So don't be afraid so much of a little bit of symptoms. The other way to think about this is similar to and stolen from the Buffalo concussion treadmill test. When you're doing a Buffalo concussion treadmill test on a patient, what you're looking for is an increase in their symptoms from pre-test to during the test of 3 or more points out of 10. So if you're sitting around right now, and this is for people that say, what if I have a headache right now that's already a 5 out of 10? What do I do? Then you use the 3-point rule. And what you're looking for, if you're just sitting there doing nothing and you already have a headache that's a 5 out of 10, how do you know that that headache is going to be made worse by doing activity? So what you're going to do is you're going to do some cognitive-based activity or some activity, and what you're looking for is an increase of 3 or more points. So if your overall symptom score is a 5 out of 10 already, what you're looking for is, if I do an activity, does my overall symptom score increase by 3 or more points? And what you would do is find out how long you can do an activity before that happens. So if it's reading, you're going to do some reading and your headache is a 5 out of 10 to start. Well, you're going to keep reading, not until your headache goes to a 6 out of 10, but you're going to keep reading until your headache goes to an 8 out of 10. Then you're going to stop and take a break. Let the headache come down. Once you're back down to kind of your baseline level, do it again. But make note of how much time it takes to get you there. So if you can do 10 minutes and tolerate 10 minutes of reading before your symptoms start, I want you to try to do 12 minutes, then 15 minutes. Then gradually and progressively, you're doing more and more and more, pushing beyond the point in which you're uncomfortable and pushing into that symptom exacerbation of 3 or more points. That way, what you'll start to realize is that 10 minutes becomes easy and you're able to get to 15, no problem. And now 20 minutes is easy, and then an hour is easy, and so on and so on and so on. But you have to kind of push beyond that. So if we start with the premise that rest is detrimental for you, and actually pushing into things is beneficial in the long run, right? It's uncomfortable up front, but it's beneficial in the long run. You're not going to set yourself back. You're not making yourself worse. And I think there's a disconnect there between what some healthcare professionals are telling their patients is that, oh, if you have an increase in symptoms, that means that you're doing damage or harmful. And it's really not the case. There's no evidence to suggest that any type of symptom increase is actually making you worse or harmful for you in any way. So let's go with that premise. So let's start with acute management. This is a standard that I do for acute patients, and this includes both work and school. So you have an injury, day 1 to 2, you're not going to fully rest. Basically, the rule of thumb is you can do anything that does not provoke your symptoms to a significant degree and does not place you at risk for having additional head trauma. So if you can go on your phone and read text messages and converse with your friends and it's not provoking your symptoms to a significant degree, then don't worry about it. You can do that, right? You don't have to avoid screens anymore unless they're bothering you. Okay? Don't just lay in a dark room. Just be in normal light. You don't need darkness unless the light is really, really bothering you. Then you can go and have periods of time in darkness. But just be aware that when you emerge from the darkness, things are going to look a lot brighter. So 1 to 2 days of symptom-limited activity, not absolute rest, but doing activities that are not provoking your symptoms to a significant degree. Basically, treat it like a casual, chill weekend. You might watch a little bit of Netflix, you might go for a walk, you might do some cooking, you might have a nap. You're gonna kind of take it easy, but not absolute rest. Keep yourself somewhat active and mobile. Day 3 to 4, you're gonna now start increasing your cognitive load from home. If you're a student, pick up some homework and start working at it at the kitchen table and start going in shorter stints, right? Start doing, okay, I'm gonna do half an hour. I'm gonna see what half an hour feels like. Then take a break, walk around, go for a walk, come back. I feel okay with that. Try 45 minutes. Once you're able to tolerate 45 minutes of working from home, or if you're a student doing homework, then the next day you can go on to half days of work or school. So I jump right into half days. Okay? If your symptoms increase to a significant degree at some point during that day, well, then you can dial it back a little bit. But again, you don't want to be right at the first sign of symptoms pulling back right away. Okay? Don't be afraid to push just a little bit into it. The modifications that I usually give to people when they're going back to half days is for school, no tests, no homework, no gym, and no recess. Gym and recess type of things generally involve sports and monkey bars and activities that could place you at risk for hitting your head again. And physical activity we haven't checked yet. So I'm not going to send somebody back to gym class when they're playing dodgeball, or let them out on recess to play in the monkey bars and play tag and run around with their friends and bump heads with people. No tests and no homework is just to take the stress off from going back to school, right? Just go in and listen, be a part of the environment. So we put those restrictions in place as a general rule of thumb. There's other modifications you can add, but that depends on the nature of the person's symptoms. I'm not a fan of giving them a hat and sunglasses and all that stuff, because what it does is it just makes them used to lower levels of light. So when they remove the sunglasses, they end up with increased light sensitivity. So I will give other modifications sparingly depending on what the patient has. I typically just start with no gym, no tests, no homework, no gym, no recess, and let them go. Take frequent breaks as needed. That's kind of my instructions. If they realize that a certain thing is provoking their symptoms, then I'll include modifications beyond that for those specific things. With work, really the only modifications, and this is just for desk work, sedentary desk work so far. I'm going to talk about, more manual labor type work, or more physical demanding jobs in the future here. If you're at a sedentary type job, desk job, basically there's no real restrictions for you. Just go do a half day of work and take frequent breaks as needed. If you need to, lower the brightness on your computer or things like that. But really the idea is just to get you into the environment, get you used to being around other people and things like that. This shouldn't really be a challenge, but if you have an increase in symptoms with this, take a break. Go home for the rest of the day. And usually the way that I will start this is just kind of pushing in and seeing what happens, right? Just go to half days, see what happens, and then we can work from there. Sometimes you got to pull back a bit, sometimes not. But I tend to lean on the side of encouragement and more pushing back into activity rather than pulling back, because I find that actually tends to make people worse. Once you're feeling good with half days, then you can start to increase into full days. So if your symptoms are not getting exacerbated up to a 5 out of 10 or 3 or more points from starting your day to your end of your day, then you can start going into full days of work. I keep the same restrictions for school. So even when they go back to full days of school, I keep the no tests, no homework, no gym, no recess. And then I gradually remove restrictions. So once they're feeling good with that, they do a couple days, no problem. Okay, good. Let's start catching up on all the homework you have to do, and let's start studying for the tests that you may have missed and get caught up on all that stuff. So that's how I work it in with that. With workers, generally, once they're back at work, they're back at work. You don't really have to lift any restrictions because you didn't really give them any. You're just giving them modifying things that can help them throughout the day to feel a little bit better.